Imagine looking in the mirror, right, and hyper-focusing on a single wrinkle. Maybe applying this $300 premium serum just to smooth it out.
Right, which we all do.
Yeah, exactly. But meanwhile, the actual biological engine that's keeping your entire body youthful is, well, it's quietly starving to death right underneath your skin.
It's basically like spending a fortune on high-end exterior paint for a house while completely ignoring the fact that the foundation is crumbling.
That is the perfect analogy. And today's deep dive flips literally everything you've been told about aesthetics and longevity entirely on its head. Welcome, everyone. I'm so excited to get into this.
Thanks. I mean, we are just so conditioned to view anti-aging as this cosmetic battle. We
Mm,
try to buff away the years, shed the fat, tighten the surface. But the structural reality of your body tells a completely different story.
Which is what we're going to uncover today.
Yeah. The true secret to aesthetic aging, to maintaining a vibrant metabolism and preserving your vitality,
Yeah.
it really isn't about your skin at all. And it definitely isn't just about losing weight. It is fundamentally about your muscle mass.
So our mission today is to decode what we're calling the feminine longevity code. We've got this fascinating stack of sources for you all today.
Some really incredible stuff in here.
Absolutely. We're looking at cutting-edge clinical studies on musculoskeletal aging, data detailing how magnetic therapy physically alters human tissue, and the pioneering work of Dr. Low Chai Ling. She's the founder of SW1 Clinic and a huge trailblazer in aesthetic medicine.
Her research really grounds all this.
It really does. We're going to explore how muscle loss uniquely devastates women during menopause and how this new frontier of technology, functional magnetic stimulation, is basically revolutionizing anti-aging from the inside out. I really want to understand exactly what is happening to this foundation.
Well, to understand the foundation, you kind of have to look at the wrecking ball that modern culture is swinging at it right now. Dr. Low Chai Ling talks about this phenomenon she calls the skinny paradox. Because, I mean, we are living in an era totally dominated by rapid weight loss.
Oh, for sure. You look at the massive global craze around GLP-1 receptor agonists, right?
Mhm.
Drugs like Ozempic and Wegovy.
Exactly. People are thrilled because the scale is dropping incredibly fast. But the clinical data reveals this massive hidden cost. During that extreme rapid weight reduction, anywhere from 25 to 40% of the weight lost is not fat.
Right, really?
Yeah, it is metabolically active, crucial lean muscle tissue.
That is wild. I mean, if someone loses 15 kilos and a third of that is muscle mass, why does the body do that? Why wouldn't it just, burn the fat and leave the muscle alone?
Because your body enters this state of metabolic triage. When your caloric intake drops that drastically, which is what happens when these drugs severely suppress your appetite, your body basically panics.
Like a starvation response.
Right. It needs readily available amino acids right now to keep vital organs like your heart and liver functioning. Fat just takes way too long to convert into immediate usable energy. And, it doesn't provide those structural amino acids anyway.
So it just goes after the easiest target.
Exactly. The body literally starts cannibalizing its own skeletal muscle just to survive.
And that seems so counterproductive to long-term health. Because muscle isn't just there to help you, like, carry groceries or look toned. It's a highly active organ.
It is a massive metabolic sink. Skeletal muscle represents roughly 30 to 40% of your total body mass.
That's a huge portion of the body.
Yeah. After you eat a meal, your muscle tissue is responsible for about 80% of your body's glucose uptake. It's the engine driving your resting metabolic rate.
So when you starve that engine and you lose that muscle, your daily calorie burn just plummets.
It completely crashes.
Yeah.
This is the irony of the skinny paradox. By sacrificing muscle to look thin quickly, you are severely damaging your metabolism. It makes long-term weight regain almost inevitable once the rapid weight loss stops.
That sets up a terrifying baseline, especially when we start looking at how aging naturally strips muscle away anyway. The sources talk about this biological phenomenon called the muscle cliff.
The muscle cliff, yeah. It's a great term for it.
From what I understand, an average person starts losing like a small percentage of muscle every year, starting in their 40s, right?
Yeah, that slow decline hovers around maybe 0.5% to 1% of muscle mass lost per year.
Which doesn't sound great, but it seems manageable. But for women, this process violently accelerates, doesn't it?
It really does. When women enter the menopausal transition, that rate literally doubles. It jumps to 1 to 2% every single year.
Oh, wow. So the compounding effect over decades has to be severe.
Very. By the age of 70, a woman can lose up to 30% of her peak muscle mass. And the main trigger for this cliff is the sharp drop in systemic estrogen.
Estrogen is doing that much heavy lifting.
Absolutely. Estrogen is fundamentally a protective hormone for muscle tissue. On a cellular level, it's constantly sending these anti-apoptotic signals to your muscle fibers.
Anti-apoptotic signals. Okay, walk me through what that actually means for the cells.
So, apoptosis is basically the biological process of programmed cell death.
Like a self-destruct sequence.
Exactly like that. When estrogen levels crash during menopause, that protective shield just vanishes. So, without those survival signals, the muscle cells basically initiate their own destruction.
That is brutal.
And it gets worse because this devastation extends to your muscle stem cells too, which are known as satellite cells. These are the emergency responders your body relies on to repair muscle fibers after you exercise or get injured.
And they get taken out too.
Yeah. A pivotal study by Collins and colleagues showed a shocking 15% decrease in the sheer number of these satellite stem cells in women, and that happened during just the 1-year transition into menopause.
Wait, just 1 year? So your existing muscle cells are dying, and the emergency responders needed to rebuild them are vanishing at the exact same time, all within a 12-month window.
It's a perfect storm.
If the biological foundation is crumbling that rapidly, I mean, my instinct is to just pour more concrete. Can you out-eat this biological cliff by just radically increasing your protein intake?
Well, nutrition is absolutely the first and most critical line of biological defense. The physiological demands on a woman's body change so dramatically during this phase.
So what are the actual numbers? How much do you need?
Research indicates you need about 1.2 to 1.6 grams of protein per kilogram of body weight daily just to maintain your structural integrity.
Okay, so for, let's say, a 60-kilogram woman, that translates to roughly 72 to 96 grams of high-quality protein every single day.
Right, which is significantly more protein than the average person consumes, especially if they aren't meticulously tracking their meals.
For sure. But the data emphasizes that just grazing on small amounts of protein throughout the day, a bite here, a bite there, that doesn't actually work. There's a specific biological tripwire you have to hit.
Yes, that tripwire is what we call the leucine threshold.
Leucine, that's an essential amino acid, right?
Correct, but its role goes far beyond just being a building block. It actually acts as an enzymatic ignition switch.
An ignition switch. Okay, I like that.
The biological process of building new muscle, which is muscle protein synthesis, it basically remains completely dormant until you introduce a bolus of 2.5 to 3 grams of leucine into the bloodstream at one time.
Oh, wow. So having like a handful of almonds or a tiny yogurt every few hours completely fails to flip the switch then.
It entirely misses the mark.
Yeah.
You would need to sit down and eat something substantial, like a 30-gram scoop of high-quality whey protein or 120 grams of chicken breast or 4 whole eggs all in a single meal to actually command your body to build muscle.
You really have to concentrate the intake to force that metabolic response.
You do. But here's the frustrating part. The dietary solution eventually hits a biological wall anyway.
What do you mean? Even if I'm eating the 4 eggs every morning?
Yeah, even if a woman perfectly optimizes her diet, hitting that leucine threshold with military precision, she's still going to likely encounter a condition called dynapenia.
Dynapenia. I've heard of sarcopenia, which is muscle loss.
Right, sarcopenia is the loss of muscle size. Dynapenia is the age-associated loss of muscle strength and quality, entirely independent of the muscle's physical size.
So if I rigorously hit my leucine threshold, I'm hitting the gym, and I'm keeping the physical size of my bicep exactly the same, why am I still losing strength?
Because that estrogen deficiency actually degrades the internal machinery of the muscle itself.
Well,
Inside your muscle fibers are these motor proteins called myosin. They physically ratchet together to create a contraction. But when estrogen drops, the myosin begins to dysfunction. It literally loses its ability to bind and pull with force.
So the muscle might look totally identical on an MRI scan, but the spark plugs inside the engine are just misfiring.
That's exactly it. And this is why diet alone cannot fully reverse the aging process in muscle tissue.
Which really lines up with Dr. Low Chai Ling's approach to this whole phase of life.
Yes, she really emphasizes this holistic understanding of structure over surface. If you read her books, like In Full Bloom, which focuses on wellness from within for mothers, and her textbook of aging skin, her core philosophy is so clear.
That external beauty and aesthetics have to be built on a foundation of internal physiological strength.
Exactly. You must address the structural wellness from within before you can expect the surface to thrive.
But if the estrogen drop is literally scrambling the electrical signal to the muscle, and even a perfect diet can't fix that misfiring engine, we need a way to physically force the muscle to contract and rebuild, right?
And that introduces the technological intervention from our sources today, functional magnetic stimulation, or FMS.
Some of the literature refers to it as IFMT too, right?
Yeah.
High-intensity focused electromagnetic therapy.
Yes, same concept. And FMS really represents a paradigm shift in how we interact with human tissue. It operates on Faraday's law of magnetic induction.
Okay, take me back to high school physics.
Yeah.
How does that apply to the human body?
Basically, the device emits a rapidly changing, extremely high-intensity magnetic field. And this field passes completely unimpeded through your skin and your subcutaneous fat.
It just goes right through.
Exactly. And once it reaches the target muscle depth, the magnetic field induces a secondary electrical current directly inside the motor neurons of the muscle tissue itself.
Wait, how does that actually differ from a traditional tennis unit? Because people have been sticking those little electrical stimulation pads to their skin for decades to try and force muscle contractions.
It's totally different. Traditional electrical stimulation relies on sending a direct electrical current across the surface of the skin, and skin is highly resistant to electricity.
Right, which is why it stings.
Exactly. The current only penetrates about 12 millimeters deep, and as it forces its way through the skin, it aggressively triggers all your superficial sensory pain receptors.
It's so uncomfortable.
You physically cannot turn a surface electrical device up high enough to actually build muscle without causing excruciating pain.
But FMS is different.
FMS entirely bypasses the skin.
Okay.
Because it uses a magnetic field rather than direct electrical contact, there is zero skin resistance and no pain. The magnetic field dives deep into the core of the muscle body.
And because it requires no physical skin contact, you can do the therapy fully closed, right?
Yep, fully clothed, just sitting or lying there.
I love this. It's basically the difference between trying to jumpstart a car by sparking live wires directly onto the exterior paint versus using like a wireless fast charger that transmits energy straight through the hood into the battery.
That is an amazing way to picture it. And the muscular response to that direct induced charge is profoundly intense. FMS bypasses the brain's natural safety limiters, producing what we call supermaximal contractions.
Supermaximal, meaning beyond what you could do normally.
Exactly. A standard 30-minute session forces the muscle to execute thousands of perfect, full-force contractions. It is physiologically impossible for your central nervous system to voluntarily recruit that many muscle fibers at that speed.
Wow. Forcing a muscle to contract thousands of times in half an hour requires an immense amount of immediate energy. The local metabolism must just go into absolute overdrive to fuel that process.
It does. The energy demand is so extreme that the local cellular environment is forced to shift gears. It rapidly depletes available glucose, and then it has to aggressively mobilize and burn surrounding fatty acids just to sustain the contractions.
So it's basically tricking the body.
It essentially mimics the physiology of an impossibly intense workout. It drastically enhances local oxygenation, blood circulation, and lymphatic drainage.
And the clinical outcomes reflect this metabolic shift, don't they?
Oh, absolutely. After a typical cycle of just 10 sessions, MRI and ultrasound imaging consistently reveal a 15 to 20% increase in actual muscle thickness.
That's incredible.
And that's coupled with an 18 to 22% reduction in the subcutaneous fat layer.
So you're getting stronger and leaner simultaneously.
Right. This typically translates to a 2 to 3 centimeter reduction in waist circumference. The technology engineers muscle hypertrophy while actively metabolizing local fat, and it does it completely without joint strain or tissue damage.
Now, discussing waist circumference and muscle thickness naturally steers the conversation toward visible aesthetics, right?
Of course.
But if we're truly examining the foundation of longevity, we have to look past just the superficial muscles. There is an entire musculature system that dictates a woman's daily life, which the anti-aging industry almost entirely ignores.
Yeah.
I'm talking about the pelvic floor.
Yes. The pelvic floor is arguably the most vital application of this magnetic technology because the menopause muscle cliff we talked about earlier, it absolutely devastates the pelvic region.
Because of the estrogen drop again.
Exactly. The precipitous drop in estrogen dramatically weakens the pelvic ligaments and severely restricts blood circulation to the area. This leads to vaginal atrophy and a whole host of functional failures.
And what are the most common physical manifestations of that?
The big ones are urinary incontinence, so both stress incontinence when coughing or jumping and urge incontinence, and also significant sexual dysfunction, particularly dyspareunia, which is severe pain during intercourse.
The sources make it abundantly clear that these are not merely physical inconveniences. These issues completely erode a person's quality of life.
They really do.
They generate intense psychological distress, feelings of inadequacy, social isolation. I mean, why is it that in anti-aging, we spend billions talking about facial wrinkles, but we completely sideline pelvic health?
It's wild.
Pelvic health arguably dictates a person's daily dignity, their sexual function, and their overall emotional well-being far more than a smooth forehead ever could.
You're completely right. And the silence is mostly driven by deep-rooted societal stigma. Patients rarely volunteer information about incontinence or sexual pain to their doctors, and honestly, doctors frequently fail to ask.
It's a huge blind spot.
It is. But this is where FMS technology is proving highly disruptive. Researchers have actually adapted this magnetic induction technology into a specialized chair.
A chair?
Yeah. A patient simply sits on the chair, completely clothed, for a 20-minute session. And the targeted magnetic field is directed straight up into the pelvic floor.
Inducing those thousands of supramaximal contractions deep within the core.
Exactly. Those deep Kegel contractions.
So it basically automates the rehabilitation. The patient literally sits there reading a book while the magnetic field forces the pelvic floor to perform an impossible workout.
It comprehensively rehabilitates the structural integrity of the pelvic floor. The intense contractions restore the resting muscle tone that was lost to the estrogen drop.
That makes total sense.
And the heightened metabolic demand improves vascularity and blood flow to the cavernous nerves. It is highly effective at treating incontinence. Clinical follow-ups note that after just 2 months of this therapy, nearly 70% of patients suffering from stress urinary incontinence consider themselves cured or significantly improved.
70%.
Yeah.
That is life-changing for so many people.
Exactly.
Restores physiological function, which in turn restores a woman's confidence and autonomy.
Absolutely.
And we are seeing this concept of structural repair extend far beyond just the aesthetic clinic. When we look at systemic frailty and whole-body metabolic disease, the impact of magnetic muscle therapy is staggering.
This is where it gets really futuristic.
Right. The National University of Singapore conducted this massive community study utilizing a device called BIXEPS, which utilizes low-level pulsed electromagnetic fields, or PEMF.
Yeah, the BIXEPS study in Singapore focused heavily on older populations. They took 101 participants ranging in age from 38 to 91, and the vast majority of these individuals suffered from pre-existing mobility dysfunction.
And the clinical protocol they utilized was surprisingly minimal, wasn't it?
It was almost nothing.
Yeah.
Researchers applied a low-level magnetic field to the patient's leg for just 10 minutes, once a week, over a 12-week period.
Wait, 10 minutes a week of magnetic exposure to a single limb? That sounds completely negligible.
I know, it sounds like it shouldn't do anything.
Yeah.
Yet the data shows 85% of the older participants experienced significant functional mobility improvement.
85%.
Yeah, alongside a heavily reduced perception of systemic pain. The researchers tracked specific individuals, like a 73-year-old housewife named Mrs. Yvette Cheek, who suffered from a buckling knee and relied heavily on a walking stick.
And what happened after the protocol?
The swelling subsided, her knee stabilized, and she discarded the stick entirely.
No way. Just threw it away.
Literally. Similarly, a 79-year-old retiree named George Teo transitioned from relying heavily on handrails due to severe leg weakness to navigating stairs completely unassisted.
That functional mobility restoration is remarkable, but the underlying systemic metabolic impact is what makes PEMF truly revolutionary, right? The therapy didn't just act locally on the leg muscle.
Right. The data showed a systemic reduction in visceral fat across the patient's entire bodies.
Visceral fat being the dense, highly inflammatory fat that wraps around the internal organs deep within the abdomen, which is far more dangerous than the soft subcutaneous fat under the skin.
Way more dangerous.
But how does a low-level magnetic pulse on a leg muscle actually cause visceral fat to melt away from the organs? I mean, structurally, how does that connect?
It comes down to mitochondrial signaling. The pulsed electromagnetic field penetrates the muscle cells and interacts directly with the mitochondria, the energy powerhouses of the cell.
Right, I remember that from biology.
So this specific magnetic frequency alters the electron transport chain inside the mitochondria, boosting ATP energy production. But more importantly, this mitochondrial activation causes the muscle cells to release myokines.
Myokines, what are those?
Myokines are chemical messenger proteins. They travel from that single leg muscle into the bloodstream and circulate throughout the entire body. And these messengers signal the body's global metabolism to upregulate fat oxidation.
Oh, wow.
The therapy essentially turns that single leg muscle into a massive metabolic sink, draining inflammatory visceral fat from the rest of the body.
The systemic implication of that is massive.
Particularly in the context of the demographic studied in Singapore, populations in Southeast Asia are genetically predisposed to hold on to stubborn, inflammatory visceral fat.
Right, which results in the Asian BMI paradox, where individuals develop severe metabolic disorders like type 2 diabetes at much lower body weights than other global populations.
Exactly. So by utilizing magnetic therapy to activate the muscle's mitochondrial signaling, researchers have found a scalable, non-invasive method to improve blood lipid profiles, strip away visceral fat, and potentially manage the progression of diabetes on a population level.
You look at these clinical outcomes, curing incontinence, reversing diabetes markers, enabling people to throw away their walking sticks after sitting with a device for 10 minutes a week, and it sounds like science fiction.
It really does sound too good to be true, but the data is there.
It forces a very practical question, though. These results are incredible, but does this mean we can just sit on a magnetic device and never go for a walk or hit the gym again? Where does traditional exercise actually fit into this high-tech future?
Right, that's the big question. These technologies are not a replacement for an active lifestyle. They act as a critical biological bridge.
A bridge.
Consider a patient like George Teo. His severe pain and muscle weakness actively prevented him from exercising. The magnetic therapy awakened his muscle tissue, repaired the neuronal connections, and restored his baseline function so that he could safely move again.
So it gets you back to the starting line.
Exactly. Furthermore, the clinical data proves that combining technological intervention with active exercise yields the absolute best results. A patient utilizing the FMS chair who also performs active resistance training will see accelerated and sustained outcomes.
So the technology rebuilds the foundation, allowing you to actually build a healthy life on top of it.
That's exactly it.
Well, it is time to synthesize the core of what we've uncovered today. The true frontier of aesthetic medicine and anti-aging isn't skin deep. It is structural.
Absolutely.
By understanding the dangers of the skinny paradox, respecting the menopausal muscle cliff, and utilizing these breakthrough magnetic therapies like FMS, we can preserve the muscle that drives our metabolism, our mobility, and our quality of life.
It really requires a multi-tiered approach. It requires respecting the nutritional biology, hitting that precise leucine threshold to ignite muscle synthesis. And when biology falters, it requires embracing breakthroughs like functional magnetic stimulation.
Whether the goal is metabolizing visceral fat, restoring the vital dignity at the pelvic floor, or just giving an aging individual their independence back, preserving muscle is the only way to preserve your quality of life.
We really have to stop endlessly repairing the paint and finally focus on reinforcing the structural foundation of the house.
Perfect. Thank you so much for taking this deep dive with us today. I want to leave you, the listener, with one final thought to mull over long after this audio stops.
It's a big one.
If our muscles are the true biological engines of our youth, and they can be completely reawakened and rebuilt by something as invisible as a magnetic field, how much of what we currently accept as the inevitable decline of aging is actually just our muscular foundation quietly starving for the right kind of stimulation? Think about it.